Good morning. I just wanted to introduce myself. I'm Lynne Landis. I'm a neonatal nurse practitioner here at Los Alamos Hospital, and I know some of you thought Dr. Amarani was going to be here. She's now partnered with us. She's a neonatologist, but she had an unscheduled event, so I'm sorry that she's not here with us. But this is part of her talk also. So today we're going to talk about the benefits of breastfeeding. We're going to specifically aim at 3 different points on the benefits of, and that's talking about the benefits to children, mothers, and society. The benefits of breastfeeding, there's many, but it's specific to our species, and it's organic. It is normal for infant feeding. It minimizes exposure to foreign proteins, and it's optimal development. You have optimal developmental outcomes. The benefits also is very customized. It promotes growth patterns. It provides multiple hormones and growth, and it promotes, most of all, mother and infant bonding. The immune benefits, there's many, but we're just going to talk about secretory IgA and other immune globulins that are passed on in the breast milk. It also has antiviral and bacterial factors. There's the cellular immune components, and there's cytokines, including interleukins. There's enzymes and nucleotides, and the top will tie this all in. The other benefits, the current evidence demonstrates that breastfeeding is associated with reduction in the risk of acute otitis media, nonspecific gastroenteritis, severe lower respiratory tract infections, eczema, asthma in the young children, obesity, type 1 and type 2 diabetes, children with leukemia, sudden infant death syndrome, and necrotizing enterocolitis. Other benefits, it increases celiac disease, inflammatory bowel disease, hypertension, and hypercholesterolemia. Childhood obesity is very profound right now in our country. One of the most significant childhood health problems in the U.S. It affects 20% of the children, and up to 30% are classified as overweight for their age. Incidence of breastfeeding actually decreases. Incidence of obesity it actually decreases in the breastfed population. The greatest protection from breastfeeding is for greater than 12 months. Obesity prevention. The extent and the duration of breastfeeding have been found to be inversely associated with the risk of obesity in later childhood, possibly mediated by physiological factors in human milk, as well as the feeding and parenting patterns that are associated with nursing. I really find this fact, interesting, and the more I've studied it, the more believable it is. It's the studies that have been show that infants' abdomens are just the size of a marble. So the amazing thing is your body makes enough milk for exactly what that baby needs, and so these are not overfed babies, which I think is an important factor. There's also cognitive benefits of human milk. It contains fatty acids, nucleotides, oligosaccharides, and taurine, which are proteins, to enhance the neural and retinal development. It enables a child to reach full developmental potential. It also, in human milk, there's fat that provides the essential fatty acids needed to actually protect the neurosystem. It provides long-chain polysaccharides, fatty acids, including doxahexaenoic acid, which is DHA, easier said, and ARA, which they're now actually putting in human milk, or in infant formula now, but it is made in human milk. So it also is very helpful and beneficial. It decreases postpartum bleeding. You have rapid uterine involution. you have decreased menstrual blood loss, and you have increase in child spacing, meaning that you have, it sometimes is used as birth control, and you don't have children as quickly. That's kind of questionable. Maternal benefits of breastfeeding that are beneficial: type 2 diabetes mellitus, 4 to 12% less for each year of the breastfed woman. This is for her without history of gestational diabetes. So in premenopausal breast cancer, the statistics show that 4.3 to 28% of breastfed mothers have less breast cancer than those that have not breastfed. Ovarian cancer is 21% less for any versus breastfeeding and evidence for dose response. Postpartum depression is less for short-term breastfeeding versus no breastfeeding. Those are pretty significant benefits. So the maternal outcomes for breastfeeding associated with decreased risk, it's been shown, the studies have shown that mothers that have breastfed their infants, and it doesn't have to be for a prolonged time, they have less rheumatoid arthritis or inflammatory processes, there's less obesity, and there's less cardiovascular disease. The community benefits, there's several. Breastfeeding is convenient, it saves money, and it is green. It reduces healthcare costs, lower employee absenteeism, and it's convenient, which is important, and it's cost effective. It's environmentally friendly, and it decreases the energy demands for production and transport of infant formula. So to summarize the benefits of breastfeeding, it definitely promotes optimal health outcomes for mother and children. It prevents infectious diseases for children. It promotes children's developmental potential, and it reduces healthcare costs immensely. It is also environmentally conscious. You don't have to crate bottles and nipples around with you. So now we'll go to questions. Anybody have any quick questions or comments? Sorry, you got in at the last.
Yes. Can you tell me a little bit about what you do?
Sure. I'm a neonatal nurse practitioner. I work here at Los Alamos. I take care of the delivery service here. Previous to that, neonatal nurse practitioners, I've worked in big units, Baylor, North Carolina, to take care of, it's a teamwork with the neonatologist and residents and fellows to take care of sick babies. So that's what I do. Here it's mostly taking care of well babies and helping mothers with breastfeeding. And I find it a privilege to do that here. Any other questions? Okay, thank you.